With this, we move on to the next panel discussion. Discussing about technology, it was really, we got a lot of insights. What is going to happen by 2047? We are looking at a scenario. So moving ahead from this technology and insurance as well as healthcare, the next topic of panel discussion covers expanding health insurance coverage, opportunities and challenges. So we are talking about moving to 2047. So how do we intend to do that is what the next panel intends to discuss. So with this, I would like to invite the moderator for the next panel. He is Mr. Ashok Kumar Lahoti, Appointed Actuary, National Insurance Company Limited. I'll just give you a brief introduction about sir. Mr. Lahoti is a fellow of the Institute of Actuaries of India and a fellow of the Institute of Faculties of Actuaries UK. So you can come on stage. He holds an MBA from the National Law University from Jodhpur and a BE from MLV Textile Institute, Bhilwara. He has extensive experience working with international and domestic insurance companies across a wide range of functions. His diverse background spans underwriting, reinsurance, investments, chief risk officer responsibilities, marketing, product development, regulatory reporting, and actuarial functions. Sir is currently serving, as I said, as the appointed actuary of National Insurance Company, prior to which he held senior management positions at Marsh and McLennan. Sir, we welcome you to this session and for moderating. Sir, so next I invite the panelist for the session. The first panelist is Mr. Shankar Bali. I invite you on stage, sir. Shankar Bali is the Joint Managing Director of Vidal Health Insurance TPA. He is having over 25 years of experience in leading large businesses in healthcare, fintech and telecoms. As far as healthcare goes, he is already representing Vidal Health, which is one of the licensed TPAs we all know. For the fintech, he has built up from scratch to bring it to 10,000 crores gross transaction value. He was able to view market conditions, customer choices and fulfillment process from the prism of technology. As far as telecom, mobile telephony was being launched, he was able to see firsthand the impact it made on lives and livelihood. Welcome you, sir, to be a panelist here. Next, I invite ma'am to be here, Dr. Rashmi Nandargi. She is the head of claims, health, travel, PA in Bajaj Allianz General Insurance Company. She is currently the vice president and she heads the health underwriting team. She is having a 20 years benchmarking success in health insurance, executive leadership in owning the entire spectrum of responsibilities pertaining to health, product development, and critical resources in defining the future state for the health product strategy. She considers herself a result-oriented individual with the ability to work cross-functionality with key stakeholders. She handles and establishes policy management processes for group health plans, drafting underwriting guidelines for retail products as well as group. And she is also in the lead development effort across multiple product teams, adding business value. In the current association with Bajaj, not Alliance anymore, right? It is the Bajaj General Insurance Company. As Vice President, she is accountable for heading the entire health, PA and travel claims. We welcome you here on stage, ma'am. Sir, it's all yours.
Yeah, thank you, sir. Good afternoon, everyone. We are quite fortunate that today we have two of the stalwarts who deal mainly with health portfolios. Ma'am deal with health claims. She's heading health claims in Bajaj, and sir is looking after complete health portfolio. So we can have better understanding, I think, how health penetrations can be increased and what are the challenges we have and what are the opportunities we have in the market currently. Now, just starting the session, setting the context, the topic is expanding health insurance coverage in terms of opportunities and challenges. Definitely, we were talking about, like in the earlier sessions, speaker has highlighted that health contribute around 40% of the portfolio of insurance industry. Earlier it was motor, now health has become the biggest portfolio in last 3-4 years. If we see health portfolio, last year the growth from 24 to 24, 25, premium wise, if we see the growth has been only 8%. So that is a slightly area of concern, and also there is look like there is an opportunity for us because 8% inflations when we talk about is around 10%, 12%. So 8% growth in premium definitely highlight there is a lot of scope for us. There is a lot of market still for us, and if we divide this premium like 1,20,000 odd crore which we have written last year, 50% is coming from employer-employee. So that is something is taken by the employer. Rest 40% is retail, and 10% around 10,000 crore is Ayushman Bharat. So this shows there is a lot of opportunities, lot of things still need to be covered. So that's something we are going to discuss. So first, ma'am, we wanted to understand on the what you feel the opportunities part from last 2-3 years. A lot of regulatory changes has come up, which has covered a lot of benefits, which have increased the benefits. A lot of new things has come up, GST and other things. So what you feel, what are the opportunities which are currently available in the market, which will increase penetrations, which will bring a lot of people into the health insurance?
Yeah. Thank you, sir, for the question, and thank you for having us here. And it's a great initiative, and it's good to hear a very diverse perspective on what's happening and how things are going to shape in future. So coming to the point that you are referring, like what is the kind of growth opportunities that we can see? As we understood from the previous panel that there is a 30 to 40% of population which is still uninsured. That is one aspect of it, which is a very big responsibility on us to make sure that we cover everybody. Adding to that, there is also a huge aspect wherein we need to see if people who are covered are adequately covered. Is the insurance which is opted is adequate enough to take care of the healthcare expenses that people may incur in long term during their life. So that is one aspect wherein we need to definitely work, a lot of work needs to be done, looking at the scope of people who are uninsured and people who are underinsured. Second, when we look at the opportunities, what is there is a lot of as on date, we are more or less working on transactional health insurance, taking care of the hospitalization expenses. There are other aspects of healthcare expenses which needs to be addressed, like the preventive care, the OPD expenses, and also taking care of the disease progression aspects. At this point of time, we see there is a lot of talk which is happening wherein people are having lifestyle conditions. There are a lot of cases coming up of organ failures, organ donations. So how can we work collaboratively and take care of these expenses and work towards building a more preventive driven healthcare system rather than the transactional taking care of the hospitalization expenses? I think these are few aspects wherein we definitely need to, there is a lot of scope that can be covered in terms of penetration.
Thank you, ma'am. Sir, the next question to you, sir. I just wanted to understand on opportunities part, like this GST now, GST has been now it's not applicable to health retail policies, whether it is young or old. For everyone, no GST is applicable. So insurance has become more affordable. Now, second part, 3-4 years COVID, which has automatically brought into awareness part, because people have realized that during the time of pandemic, there should be some sort of insurance is required. So how do you feel this type of opportunities or any other opportunities is going to, from your experience, can bring more of people under the insurance umbrella or health coverage umbrella?
Thank you, Ashok, and what a wonderful gathering, great opportunity. Thank you. Thank you for inviting me here. Firstly, I don't think anybody remembers COVID now. We all were, rubbing our hands, skins off our hands in those days, but now we are back to not adequately self-protecting behavior. So I don't think COVID impacts so much. But really, there were a few panelists before who've been talking about this missing middle as an opportunity for health insurance industry. I think for insurers and for regulators to look at these segments is where the opportunity of increasing penetration is going to be. All urban centers are now completely teeming with delivery workers, gig workers, who live in atrocious conditions and drive across roads. Their health covers are extremely poor. Similarly, senior citizens as a segment is really which is open. It's a very large segment in India, already about 10-12% of our population. So 14-15 crore people who will struggle to buy an insurance today once you cross 60. So probably some more well thought out products to address these segments, and of course finding ways to reduce the total cost of that insurance that people are going to buy is where the trick lies for us to increase penetration.
Great, sir. Ma'am, when you started from points like preventive cares, like right now products only mainly cover IPD covers, but lot of coverages like OPD, diagnosis or preventive cares, lot of coverages are not built up in insurance policies. Second part, sir was talking about missing middle. Third, we have seen like senior citizen above 60, the premium are becoming quite unaffordable. So these three segments, I think do you feel that how can we cover all these three parts, or any other parts you feel we can cover which can further increase health insurance part or health affordability part?
First, I would like to touch upon the missing middle piece, which we all have been discussing, I think since last 4 or 5 years in every forum this has been discussed. I think if we can try to build a successful model, not in silos or working as separate parties, but working in collaboration, I think we can definitely build a successful model with a very baseline cover. If we and the payers and the providers come together, sit across the table, discuss and see how can we make a model which is very, very affordable, which also counter impacts the inflation, which today both the payers and the providers are often seen, we are often seen discussing with the hospitals discussing with the insurance companies like, okay, this is, inflation is 14% or 3% or 6%. So, but there is a need for everybody together to come together sit on a table and discuss and build a plan. I think that is something wherein the payer and the provider will have skin in the game, and it would be a successful model. I think that is something which can be thought for the missing middle. And second point which you said on the preventive aspect, yes, till date, I think till last 2-3 years ago, we were focusing only on the hospitalizations, but in last 2-3 years, many of us have come up with the OPD plans, the preventive care plans, building up the preventive care tests in the policies. But yes, now is the time that we need to move beyond just prescribing the preventive care test or paying for the preventive care test, but also see that what are the outcomes that are coming of the preventive care test, how can we handhold the patients in collaboration with the hospital to make sure that we incentivize them for being healthy and not just pay for their hospitalization claims, and make sure that the disease progression is delayed and they stay healthy in their productive years at least. So I think definitely there is a lot of room for us to work on this aspect. Yeah.
Sir, there is still debate going on what is the correct model for country like India, where a lot of diversity is there, demographic changes are happening in every few kilometers. We have 3 models. One is Ayushman Bharat, where public and private partnership is happening. Second is health retail. Third, where people are buying policies and taking treatment. Third is employer-employee. So what you feel, what type of model do you feel, some sort of covering complete populations of around 140 crore? Because we still feel that this model has covered 50%. Now still there is 50% of the population, 40-50% population is still need to be covered through some sort of health assurance or insurance model. So do you feel like which type of populations which are not covered, and how can we cover quickly within 3-4 years, 5 years, rather than waiting for 2047?
It's an interesting question, and outside also we were discussing briefly. if you ask me, in the last few years, Ayushman Bharat has had tremendous impact on how various governments, health is a state subject, but Ayushman Bharat, driven from NHA, from center, has managed to drive states to spend on health, build that infrastructure. We saw in the morning what Bengal has done, an outstanding job. Similarly, all states have great success stories. So that penetration of 50% of India's population, 60-70 crores, which is being served by Ayushman Bharat, is just a wonderful example. But the question really is that this missing middle that we keep talking about, is there some kind of Ayushman Bharat private sector overlap can be created to service these people? So largest part of the missing middle is the MSME migrant workers who go, farm workers who travel from Hindi states to various agriculture states. How do they get covered? Is there some way to create an overlap and then be able to service them? I find that a lot of time when we talk about costs, it just gets to be a he says, she says between payers and providers. Providers are increasing costs, and therefore payers don't have a choice to increase premium, and they don't pay. But collaboration is the word really, where we need to all come together and find profitable solutions, not subsidized solutions, but profitable solutions to get deeper into this, these segments which have not been touched. A big piece is going to be awareness, and I think what Rashmi was saying is really, really critical. Nobody talks about prevention of illness. I mean, this whole ecosystem is only talking about how to fund cure after you fall sick. India has a great opportunity. We started health insurance covers when we are still a young population. Only about 10-12% are over 60. So at this stage, if awareness and can all stakeholders participate in building a health and wellness awareness and culture, eating right. We read recently health ministry saying that they want to make people aware about samosas and what goes into trans fats and stuff like that. It is a good thing. It makes things makes awareness strong. GST has been a wonderful initiative, not just for reducing cost, but also it has just brought health insurance top of mind to entire country. And that to me is going to be a much greater service than just reducing cost. Overall cost reduction will probably need to come through a much more collaborative effort from all the stakeholders.
Thank you. Ma'am, like taking up a point on cost reductions, main part is inflation, which cost reduction is inflations. So another part is fraudulent claims. What are other things you can think of other than these two? How can these 2 points you think we can reduce cost part, fraudulent part? What are your views? How can we reduce that? Third, any other challenges we face that you feel that we can reduce some other way? Can you enlighten us? That would be helpful.
Yeah. I think you touched upon a very, very critical aspect for health insurers, the inflation part and also the fraud. I would say there are two aspects to it. One is the hardcore fraud, wherein we are receiving documents wherein the hospitalizations are not being there, and we see those kind of hardcore frauds coming from various parts of the countries. Here, one important aspect is, even though we identify these things, we know where are these kind of hospitals or clinics which are set up and they are sending fraudulent, executing fraudulent practices. But there is no concrete outcome or concrete actionables against these fraudulent practices. There are IRDA regulator platforms, and then GI Council is also given a platform wherein all the insurers are collaborating and sharing the practices, and the data is being collated. But as a medical industry, there is a need of regulator who can also address this aspect of these fraudulent practices which come into picture. And second, also to some extent there is a part of abuse which comes into picture when we talk about inflation, over prescription of services, over prescription of consumables, over prescription of investigations. I think this aspect also needs to be dwelled upon when you talk about inflation. So part of the inflation is coming for this, and second, the most important factor, the inflation is coming from the modern treatment methods, the robotic surgeries and the advanced treatment methods for cancers, the monoclonal antibodies and the advanced treatment methods. That also is contributing to the inflation piece which is coming into play. I think that is something that we need to be ready as an industry to embrace the advanced treatment methods so that the outcomes are very, very good and patients lead healthy lives. But if we are able to control the abuse and the fraud aspect, I think a large question would be addressed on the inflation part.
Do you think that some standardized treatment workflow is we have to develop, or it is in the nascent stage or something it can help?
Yeah. So recently the standard treatment workflows have been released, and all the insurance companies under the guidance of GI Council and Sagar sir's leadership, we are in the process of implementing these STWs for few treatments which are contributing to a large aspect of health insurance claims. That definitely will address to a large extent the abuse part which we were referring to.
Sir, anything you feel from from your experience that anything from, because one stakeholder is also regulator. So as a body, because in Chara definitely we have discussed a lot, but something you have any idea from regulatory aspects which can be something can be done, something we have not touched upon, or on it is something on data part or IT part which can be done to improve health coverages or to bring more people under this gamut?
So we are still in relatively early in the evolution of health cover, and I was saying we are still a young country, but I must say the regulator in the past 20 years has done incredible job in standardizing processes, and now the initiatives being taken on NCHX to bring claims on a common platform, bring providers, everybody on a common platform to streamline all that. And like you're saying, medical protocols, clinical protocols, standardization, etc., will go a long way in bringing some semblance of cohesion in the way healthcare is being priced in the country. But and technology has a huge role to play in this. We are seeing across the industry investments in AI to identify frauds, identify wastage and abuse areas, and then give feedback to the stakeholders, to the hospital, to see that these are the areas you can reduce and manage inflation significantly.
Yeah, ma'am. I think we are somewhere in between the lunch, so I think we have to quickly wrap up in 4-5 minutes. Otherwise, Saurav will. So, ma'am, what you feel like you are also as a company running Ayushman Bharat schemes, and we have seen first time in one of the schemes from my experience that premium rate rather than increasing it has decreased. So I would say some sort of deflation has happened rather than inflation. So what learning can we learn as a whole industry from these schemes? What are the things I think we can understand from that schemes which help in reduction of premium rather than generally increase by 10-15% every year?
Yeah. I think that's a very good example wherein how medical cost or the treatment cost can be managed effectively. So there we predominantly looked into the patterns of treatments, what kind of claims, which hospitals, how they are coming, and also we tried to implement the standard treatment workflows. We introduced a team of doctors who can then collaborate with the hospitals to execute the standard treatment workflows and see how they are being implemented in the course of the prescribed packages given by the government. Yes, this has helped to a large extent in controlling the costs for the Ayushman Bharat scheme. But outside that also, I think lot of work needs to be done. We are also very closely working with the hospitals to see how we can standardize the packages, how we can rationalize the treatment cost not being unfair to the hospitals or not being very high on the premium side. So that is something that definitely will help in rationalizing the healthcare costs and regularizing the premiums.
Thanks.
Yeah.
One last question, sir, before we wrap up. We have seen Ayushman Bharat has bring a lot of changes in terms of health sector. I would say lot of populations, if we talk about today's West Bengal, they covered 8.5 crore of they covered almost everyone in West Bengal. Now, if you see Gujarat, lot of where we have seen tremendous coverages has been happening, and a lot of people are getting covered now. It's moved from BPL to now it is moving to next level to everyone. Like if you see Punjab also, they are coming up with the idea to cover everyone. If you see Uttarakhand, they are also coming with Ayushman to cover everyone. All people, is this type of model you feel in going forward in future can be a game changer, can bring everyone under some sort of health insurance and assurance? Some states are also moving one step ahead from 5 to 10 lakh, 20 lakh coverages. So do you think this type of model can be a good for Indian most of population to cover?
Certainly, certainly. And globally, governments are the largest spenders in health sector. And so in India, like I was saying earlier, Ayushman Bharat being a central scheme has pushed state governments to spend more and more, and that's where the deeper penetration is happening. Now state employees are getting covered better. That's also a huge chunk which was earlier had very, very minimal coverage, and in many states no cashless. Those pensioners are getting covered. So certainly this is the way to go. But I still feel just government will not be able to do it for us. We need private sector providers and payers to kind of come forward and participate, not as a subsidizing not with a subsidizing approach, but with a creative approach to do profitable business at bottom of the pyramid, like you were saying.
Thank you. I think we have got some sort of very good points that we have a lot of things still to cover. OPD, preventive cares, and some sort of collaborations is required. And definitely, sir has highlighted that public sector government can't be completely cover everyone. There should be definitely private sectors, insurer or infrastructure would be needed. Thank you.
Thank you so much to the moderator as well as the panelists. I think it was a really good discussion. I would like to request Mr. Sayantan Chatterjee, Co-Chairperson, National Health Committee, Bengal Chamber, to kindly come on stage for presenting the memento. Thank you so much. Thank you